Let's discuss general diagnosis of the face, the evident blue veins on the face, face twitching, spider angiomas. Evident blue veins on the face. Blue veins appearing on the face usually mean stagnation of phlegm and dampness, stasis, and toxins in the body that are unable to be excreted, thereby obstructing the circulation of blood and qi, resulting in blue veins enlarged, dilated, twisted, and a change in color. Bulging vein on the temples are a sign of dizziness and headaches. An evident blue vein on the forehead signals enormous stress and problems with the lower burner, which refers to the part of the abdomen below the belly button, where the kidneys, bladder, small intestine, and large intestine resides. Evident bulging blue veins on the bridge of the nose indicates food's retention and indigestion. An evident blue vein at the corners of the mouth or on the chin indicate ailments in the reproductive system. Bulging mishap veins that are dark purple in color indicate a susceptibility to coronary heart disease. Next is the face twitching. The twitching of the eyelids, corners of the mouth, and facial muscles are often related to emotional factors, and it is more often seen in women than men. The causes of this condition include stagnation of liver qi, wind pathogen blocking collaterals, liver wind stirring up internally, and wind phlegm obstructing collaterals. Spasm accompanied by lightheadedness and tinnitus indicating a stagnation of liver qi. Sudden spasm accompanied by headaches and tearing up indicating an attack of exogenic wind and cold obstructing the Yangmin collateral. Face twitching and muscle numbing on the affected side are a result of qi deficiency due to prolonged illness and wind phlegm obstructing collateral. Next, the spider angiomas, spider moles on the face. A spider mole is one with a small artery at the center surrounded by a slender dilated capillaries branching out like spider legs, giving it its name. They are often found in acute chronic hepatitis or cirrhosis cases and pathogenic spider moles that can also be seen in pregnant women and healthy people. Spider moles in women during puberty and pregnancy are a normal condition caused by excessive secretion of female hormones. The sudden appearance of spider moles in men or elderly women are a probable sign of chronic hepatitis or cirrhosis. A rapid increase in the number of spider moles signals the worsening of a liver disease. So here we have to apply cold and hot towels alternately on your face. Eliminating facial puffiness can be done through invigorating the spleen, replenishing the lungs, and improving qi circulation to eliminate swelling and clearing away water. Here are some methods. Apply cold and hot towels alternately on your face, which will improve the blood circulation on the skin and help eliminate unwanted water retention on your face. We can have also the red beans and coix seeds. Eat more food with properties that promote the flow of water to eliminate swelling. Example, red beans, coix seeds, and winter melon, which increase metabolism and reducing swelling. Consume a light diet, eat less foods that are oily or strong in taste, and eat more foods that are low in salt, sugar, and oil. Maintain a regular schedule of work and rest to ensure that you have enough sleep. Good rest is conducive to regulating the body metabolism. Thank you for your attention.
We discuss interviewing for somnolence. Somnolence means dozing off frequently in the daytime or early evening. Some Chinese books also add that the patient wakes up as he or she breathes out and then dozes off again. Somnolence also includes some people's physiological need of sleeping a longer time than normal, which in adults is approximately 7 to 8 hours. Somnolence may be due to a deficiency, usually of qi and or yang, or to an excess such as dampness or phlegm. The most common situation is a combination of a deficiency of spleen and or kidneys and a full condition consisting of dampness or phlegm. Of course, when the patient complains of somnolence, one should first inquire about the patient's working hours. If the patient works very long hours, a very common occurrence in Western industrialized societies, somnolence is then not a pathological symptom. So here are the patterns for somnolence. Spleen-yang deficiency. The somnolence will be associated with desire to lie down, loose stools, pale tongue, weak pulse. For kidney-yang deficiency, the somnolence is accompanied by listlessness, backache, dizziness, tinnitus, pale swollen tongue, deep weak pulse. For somnolence due to dampness, there will be somnolence after eating, feeling of heaviness, sticky coating, slippery pulse. Somnolence due to phlegm, there is somnolence after eating and in the morning, muzziness of the head, dizziness, swollen tongue with sticky coating, slippery pulse. Spleen-yang deficiency with dampness, which is somnolence especially after a meal, there will be tiredness, feeling of heaviness and muzziness of the head, feeling of heaviness of the limbs, poor appetite, epigastric fullness, sticky taste, no thirst, loose stools, feeling cold, cold limbs, pale and wet tongue with sticky coating, soggy pulse. This is the most common cause of somnolence. Acupuncture points, REN 12, stomach 36, spleen 6, bladder 20, bladder 49, REN 9, REN 5, bladder 22, DO 20, and moxa. For spleen qi deficiency with phlegm, there will be also poor memory, slight depression, mental confusion, feeling of heaviness and muzziness of the head, feeling of oppression of the chest, dizziness, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of limbs, loose stools, tendency to obesity. Pale swollen tongue with sticky coating, pulse is slippery weak. Acupuncture points, REN 12, stomach 36, spleen 6, bladder 20, bladder 49, stomach 40, REN 9, REN 5, bladder 22, and DO 20. For somnolence due to spleen and heart qi deficiency, there will also be poor memory, slight depression, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of limbs, loose stools, palpitations, shortness of breath on exertion, pale tongue, empty pulse. Acupuncture points, REN 12, bladder 20, bladder 49, stomach 36, heart 5, bladder 15, and DO 20. For somnolence due to kidney-yang deficiency, there will also be poor memory, lower backache, cold knees, feeling cold, bright white complexion, weakness, tiredness, lassitude, abundant clear urination, urination at night, impotence, decreased libido, pale and wet tongue, deep weak pulse. Acupuncture points, kidney 3, bladder 23, bladder 52, REN 4, DO 20 with moxa. So for somnolence, we always use DO 20 to help the patient. Thank you very much for your attention.
Pattern differentiation, foundations of TCM diagnosis. To understand TCM pattern discrimination, it is crucial to review some basic concepts and theoretical underpinnings of Chinese medical theory. TCM theory is characterized by a peculiar approach to diagnosis and treatment that applies a series of flexible individualized parameters based on a naturalistic integrative view. TCM does not use complicated or aggressive procedures to confirm a diagnosis, instead relying mainly on the careful analysis and interpretation of information obtained through various forms of patient observation. One of the basic theoretical pillars that supports the TCM system is the concept of the body as an integrated unity or whole body system. According to this view, all external expressions of the condition of the body are observed and compared with external environment and then analyzed systematically to explain what is occurring inside the body of the patient. TCM diagnosis and the black box model. The TCM diagnostic model could well be likened to the so-called black box model, which seeks to determine the contents of the black box without opening it, through the application of external stimuli and appreciation of external reactions. Following this analogy, the body is a black box and what is going on inside is determined, example, diagnosed, through what comes out of the box. The signs and symptoms, pulse and tongue images, facial expression, feces, etc. The salient feature of this model is that it preserves the integrity of the whole system. This concept is expressed in the chapter, The Foundation of the Organs, in the Neijing, one of the older sources of Chinese medical theory, specifically in the following expressions. All what is in the inside reflects on the outside, and the inspection of the exterior lets you determine the state of the internal organs. Then you can know what kind of disease affects the patient. The holistic or integral concept of TCM. The concept of holism in TCM has two aspects: the body as an integrated whole and the unity of man and nature. TCM views the human body as an organic whole. Although the body is composed of various tissues, all parts and functions of the body, organs, channels, vital substances, etc., are always connected to each other, functioning as a unity. Furthermore, the human being is an active part of the whole universe. On one hand, the natural world constantly influences the body, and on the other hand, the body adapts to conform to variations in the natural environment. No part of the whole is isolated. All are mutually related. Therefore, when there is a disturbance in one region, sooner or later it will affect other parts of the whole. According to TCM, the disruptions caused to the adaptation processes of the organism by those disturbances are the origin of disease. The 5 phases and the organic energetic systems. The 5-phase system is another theoretical construct of classical Chinese naturalistic thought that reflects the holistic concept when applied to TCM. This system establishes functional correspondences between various natural phenomena under the main categories of the 5 phases. These are water, wood, fire, metal, and water. 5-phase theory applied to TCM recognizes 5 main depots. The most important organs in the body, namely lung, liver, heart, spleen, and kidney, and the rest of the tissues of the body, which are structures, internal organs, sense orifices, emotions, and the spiritual or mental functions, are organized into systems under the aegis of these Zhang organs, each of which is linked to one of these 5 phases by virtue of their functional relationship, as we can see in table 3.1. This system of relationships extend to pathology and treatment. When one component of one of the organ system is diseased, the disease is said to pertain or to be the province of the corresponding organ. Acupuncture points are in turn associated with each of the Zhang organs and can be chosen to treat disorders affecting their associated tissues or body structures. For example, a disease affecting the bones could be treated using acupuncture points on the kidney channel. Moreover, diseases in one part of these organ systems are frequently seen to affect its other parts. In our example, the patient may also report discomfort in the ears and lack of willpower to act. So in this table, we see the organic energetic system, the 5 levels, and the 5-element system. In the 5 levels, we have the body structure, organ, sense organ, emotion, spiritual, mental activity. And in the 5-element system, we have water, wood, fire, earth, and metal. In body structure, bones pertain to water, sinews to wood, vessels to fire, muscles to earth, and skin to metal. In the organ, kidneys pertain to water, liver to wood, heart to fire, spleen, earth, lungs, metal. In the sense organ, the ears is to water, eyes to wood, tongue to fire, mouth to earth, body, hair to metal. In the emotion, Fear is water, anger is to wood, joy is to fire, thoughtfulness to earth, and melancholy metal. In the spiritual mental activity, will is to water, courage is to wood, ideation is to fire, ideation is to fire, consciousness is to earth, and instinct is to metal. The holistic approach of TCM diagnosis and practice. TCM stresses the need for a holistic approach to treating illness. Patients are not divided into parts, where every condition is localized and diagnosed separately, with a specialist required to deal with each part and individual condition and treatments that may frequently be at odds with each other. Chinese medical thoughts call for a therapeutic strategy that keeps sight of the patient's overall health, addressing all symptoms and complaints as part of one disease process. This produces faster, superior, and more appreciable effects for patients. Individualized diagnosis. Individualized diagnosis and treatment constitute an important principle of TCM. In the practice of Chinese medicine, diagnosis and treatment are always performed with the patient's age, gender, constitution, and lifestyle in mind, as well as the presentation and evolution of disease. The dynamic balance between health and disease. Classical Chinese thought holds that all phenomena in the universe are moving and changing constantly, continuously. This is true in TCM, where the physiological phenomena of the human body are perceived to be a process of constant transformation and interaction. Normal physiological and pathological conditions are a pattern of continuous flux. It is this dynamic balance that maintains health, and disease is seen as a deviation from the correct evolution of this pattern. Diagnosis adjusts to the dynamic process of disease. It follows then that disease is not a static picture in the system. TCM regards disease as a dynamic process, continuously changing and adjusting to the environmental, dietary, emotional, and other factors attendant to the situation of the patient. Thus, diagnosis and treatment need to be continuously adjusted to the evolution of the disease dynamic for each individual patient. Thank you for listening.
Let's now go to differential diagnosis in Western and Chinese medicine. Our topic is anxiety. So first, let's take up the Western differentiation of anxiety. In Western differentiation, the causes of anxiety include, first, hyperthyroidism. This condition will manifest with anxiety with weight loss, increased appetite, restlessness, menstrual irregularities in women, diarrhea, and goiter. Second is pheochromocytoma. This condition will manifest with bouts of apprehension with severe headache, pounding heart, sweating, chest pain, nervousness, irritability, increased appetite, and loss of weight. Next cause is hypoglycemia. This condition will manifest with anxiety with fatigue, malaise, nervousness, irritability, headache, hunger, cold sweats, rapid heart rate, blurred vision, confusion, and relief from eating. Fourth cause is depression. And this will manifest with anxiety with difficulty sleeping, traumatic change in appetite, fatigue, low self-esteem, poor concentration, restlessness, withdrawal from society, and suicidal thoughts. Fifth cause is menopausal syndrome. This will manifest with anxiety with hot flushes and night sweats, mood swings, irritability, irregular menstruation, insomnia, vaginal dryness and painful sexual intercourse, and decreased sex drive. Sixth is premenstrual syndrome. This will manifest with anxiety with irritability, depression, feeling emotional, headache, breast tenderness, feeling bloated, weight gain, poor sleep, poor concentration, backache, acne flare-ups, constipation or diarrhea, and food cravings. And seventh is post-traumatic stress disorder. There will be anxiety with recurrent distressing memories of an event, recurring dreams of the event, flashbacks, inability to remember important aspects of trauma, feeling detached, and depression. Now let's go to the Chinese differentiation of anxiety. Here we do the diagnostic questioning according to first, the organ interrelationship. First, we take on the clue cycle. This involves the Shaoyan organs. Water failing to restrain fire. This involves the kidney and the heart. Next is the Shang cycle. This involves the heart and the spleen, heart being the mother of the spleen. Next is the channel opposition pairing with the heart Shaoyin and the gallbladder Shaoyang. Next, we ask about what aggravates this anxiety. So if anxiety is aggravated with tiredness, it indicates deficiency. If it's aggravated with loud noises, changes of routine, there is heart and gallbladder qi deficiency. Next, we look into the type of anxiety. If it is due to heart qi or blood deficiency, there will be palpitations with apprehension and worry. If it is due to kidney and heart qi deficiency, there will be palpitations caused by start or fright and worse on waking. If it is due to liver qi stagnation, there will be depression, hypochondrial distension, sighing, and moodiness. If it is due to heart, blood, and spleen qi deficiency, there will be phobias and panic attacks. If it is due to heart, gallbladder deficiency, there will be frequent severe anxiety, panic attacks, apprehension, fearfulness, worry, and phobias. And if it's due to phlegm heat, there will be anxiety, nervousness, and often waking at 4 a.m. Now let's go to the tongue. If the tongue is pale, it means qi and or blood deficiency. If red, it means yin deficiency. And if it is thick with yellow coating, it is due to phlegm heat. Now let's look into the pulse. If it's knotted and irregularly irregular, it is heart qi and yin deficiency, leading to heart qi stagnation. If the pulse is fine and rapid, it indicates yin deficiency. If it is rapid and slippery or wiry, it indicates phlegm heat. And if it's fine and forceless, it indicates heart qi deficiency. Now let's go to the Zhang Fu patterns. Anxiety in Chinese medicine may mean heart qi deficiency, heart qi and yin deficiency, heart and kidney yin deficiency, stagnation of liver qi, heart, blood, and spleen qi deficiency, heart and gallbladder deficiency, and phlegm heat harassing the heart. Thank you for your attention.
Let us go to Zhang Viscera. The topic is kidney physiological functions, part 2. The main functions of kidney's essential qi are as follows. Number 1 is controlling reproduction. The reproductive function of the kidney has two aspects. One is sexual functionality and the other reproductive capacity. In CM, reproductive capacity is principally controlled by the state of kidney essence. Kidney essence provides the original substance for the embryo and is the material foundation of the vital activities. The kidney's essential qi continues to accumulate as a person grows. As it reaches fullness, the body enters into puberty and begins to produce a substance that simulates the maturation of reproductive function. The substance necessary for promoting the development and maturation of the gonads and for maintaining their reproductive capacity. It is known as tiangqi. There is no translation for this term. As tiangqi reaches a certain level, the body shows a very important change. A man is now able to produce sperm and a woman capable of menstruation. At this stage of maturation, during sexual intercourse, the essence of the man combines with the essence of the woman, and pregnancy may result. Thereafter, as the person moves through middle age into old age, the kidney's essential qi also moves from fullness into gradual decline and eventually fades altogether. It is clear that the rise and fall of tiangqi depends on the fullness or decline of the kidney's essential qi, and the human body's reproductive capacity is expressed through tiangqi. Number 2 is promoting growth and development. All the stages in a person's life, including birth, childhood, prime, Senescence and death are closely tied to the fullness or deficiency of the kidney's essential qi. Beginning in childhood, it rises exuberantly, enabling the body to grow and develop rapidly. By the age of 7 or 8, permanent teeth replace baby teeth and hair grows longer. By the age of 14 or 15, Tianqi reaches a threshold and the reproductive organs approach maturity. Both boys and girls now possess the capacity for reproduction. By early prime, the essential qi of the kidney is especially abundant. The body is now stout with strong sinews, bones, and teeth, and the spirit is vigorous, and the hair is shiny. In old age, because the essential qi of the kidney now declines, the body also begins to degenerate. The reproductive capacity and sexual function start to fade, and the hair turns gray, the teeth become loose, the back becomes humped, the gait becomes unsteady, hearing becomes impaired, and the complexion becomes haggard and lusterless. It is thus clear that the state of kidney essence determines the body's growth and development. Insufficiency of the essential qi of the kidney often leads to abnormal growth or development. For example, insufficiency of essential qi of the kidney during childhood can cause delayed growth and development, including mental development. The main manifestations are the 5 delays and the 5 weaknesses. The 5 delays are delayed standing, delayed walking, delayed tooth eruption, delayed talking, and delayed hair growth. The 5 weaknesses are weak hands and feet, weak head, weak neck, weak muscles, and weak mouth. Number 3 is resisting disease and delaying senescence. Kidney essence is important for the resistance against disease and the postponement of senescence. When it is ample, the body has a strong constitution, great vitality, and longevity. Conversely, its deficiency causes poor growth and development, a weak constitution, premature senescence, and diminished capacity to resist disease. The result is that external evils can take advantage of this weakness and invade the body, inducing many illnesses. Therefore, physicians of every generation have emphasized the importance of strengthening and nourishing the kidney in order to prevent or postpone senescence. Most of the herbs used to fight senescence have the ability to strengthen the kidney. Number 4 is facilitating the production of blood. In CM, the production of blood is closely tied to the kidney, as well as to the heart and the spleen. Kidney essence can transform into blood, and this has given rise to 2 sayings. Number one is essence and blood share their source, and the second is the source of blood is in the kidney. The full expression of the kidney's functions relies on the cooperation of kidney essence, kidney qi, kidney yin, and kidney yang. The kidney stores essence, and the kidney essence transforms into kidney qi. If kidney essence is ample, so will kidney qi be ample. And conversely, if kidney essence is deficient, so will kidney qi be deficient. Hence, the two together are often called essential qi of the kidney. Essential qi is the foundation of all vital activities. By the theory of yin and yang, essential qi can be subdivided into kidney yin and kidney yang. Kidney yin, also known as primordial yin, is the ultimate source of all yin fluids of the human body and is necessary to moisten and nourish all the visceral and other organs and the many tissues. Kidney yang, also known as primordial yang, is the ultimate source of all yang qi of the human body and is necessary to warm and activate all the visceral and other organs and the many tissues. Since the kidney houses yin and yang together, it is also known as the house of water and fire. Under normal conditions, kidney yin and kidney yang restrict, promote, and depend on each other in order to maintain the dynamic balance of yin and yang. Deficiency of kidney yin can lead to the flaring of fire, manifested as hotness in the palms, afternoon fever, and night sweats. Males may have nocturnal semen emissions, and females may have sexual dreams. Deficiency of kidney yang can lead to diminished capacity to warm and activate. This is manifested as coldness and pain in the lumbar region and knees, polyuria with light color, and a pale and puffy tongue. Males may have premature ejaculation or impotence, and females may have infertility because of coldness in the uterus. The mutual opposition and mutual dependence of kidney yin and kidney yang is necessary for the dynamic equilibrium of yin-yang for the entire body. Because the kidney has such an important role in growth, development, reproductive capacity, and postponement of senescence, it is regarded as the innate foundation of the human body. Thank you so much for your attention.
Let's discuss diagnosis according to Sangfu organ patterns, the heart blood deficiency. The patterns of heart yin deficiency and heart blood deficiency are very similar in their symptoms and signs because heart blood is an aspect of heart yin. The differentiation between the two patterns is based mainly on the presence or absence of yin deficiency or blood deficiency signs in the symptom picture. Otherwise, the symptoms and signs are very similar. Etiology. Blood deficiency arises from three main reasons. Blood is lost either through bleeding or overconsumption, such as excessive physical training or excessive mental activity. There is a poor production of blood. The diet is not rich enough in food that directly nourishes the blood. Blood loss, such as in childbirth, heavy menstrual bleeding, bleeding disorders, operations, and so on may result in heart blood deficiency. These factors can be relevant for a long time. In some cases, several years after the loss of blood has occurred. Excessive exercise, such as physical training, will consume blood. In some cases, excessive mental and emotional activity can also consume heart blood. A poor production of blood will be due to deficient conditions in the organs involved in the production of blood, in which case etiological factors that weaken the spleen and kidneys will be involved. Even though the spleen and kidneys are in balance, heart blood deficiency can arise if the person's diet is deficient in blood-nourishing foods. Heart blood deficiency is often seen simultaneously with or a consequence of liver blood deficiency. Symptoms and signs, there is insomnia, dream disturbed sleep, palpitation, fatigue, dizziness, being easily startled, poor memory, being mentally absent, anxiety, sallow face, pale face, pale dry lips, pale dry and thin tongue, fine or choppy pulse. The pulse may be weakest in the left tune position. Key symptoms, there is palpitation, insomnia, poor memory, pale lips, and a pale tongue. Treatment principle is to nourish heart blood. For the acupuncture points, choose from heart 7, REN 14, REN 15, REN 4, UB 17, stomach 36, spleen 6, UB 15, UB 17, and UB 20. Needle technique is tonifying. Moxa can be used, particularly on UB 17. Explanation, heart 7, REN 14, REN 15, UB 15 nourishes the heart blood. REN 4, UB 17, stomach 36, spleen 6, UB 20 nourishes blood. Relevant advice, when there is a heart blood deficiency, it is important to eat a diet that nourishes the blood. Things that nourishes blood include green leafy vegetable, beetroot, seaweed, dates, kidney beans, black beans, aduki beans, red meat, bone marrow, blood, sausages, heart, and liver. The patient should avoid sugar, stimulants such as coffee, and too much alcohol. Nettle tea will be beneficial for them to drink. The patient should not only eat a diet that is rich in blood nutritious food, but they should also eat a diet that is beneficial for the spleen qi. This means eating warm, prepared foods such as soup, stew, baked vegetables, and so on, and avoiding salads, raw food and beverages that have a cold energy or produce dampness. Heart blood deficiency can be caused by liver blood deficiency, spleen qi deficiency, spleen yang deficiency, heart qi stagnation. Heart blood deficiency can result from heart yin deficiency, heart blood stagnation. For the summary, the heart blood deficiency, etiology, diet lacking in blood-producing foods, prolonged anxiety and worry, heavy bleeding. Underlying or accompanying pathology, spleen qi deficiency, heart qi deficiency, heart yin deficiency, liver blood or yin deficiency, nutritional disturbance, neurosis, tachycardia, arrhythmia, anemia, hyperthyroidism. Signs and symptoms, there is palpitation, dizziness, insomnia, dream-disturbed sleep, anxiety, poor memory, easily startled, dull complexion, pale lips. The pulse is fine or choppy. The tongue is pale and thin. Treatment principle, we have to nourish the heart blood and calm the shen. For the acupuncture treatment, the Heart 7 supplements heart blood and calms the mind. Ren 14 supplements heart blood, calms the mind. Ren 4 supplements blood. Bladder 17 with moxa gathering 0.4 blood. Bladder 15 boosts heart chi and calms the shen. Pericardium 6 supplements heart chi, pacifies the mind. Ren 15 supplements heart blood, calms the shen. Bladder 20 supplements spleen to produce blood. Spleen 6 supplements blood. Needle with supplementation and moxa. Thank you for your attention.
We will discuss etiology in Chinese medicine. This time we focus on summer heat. Illnesses of summer heat are prominently seasonal, occurring mostly between summer solstice and autumn equinox. The plain questions states, before the summer solstice, it is a warming disease. After the summer solstice, it is a summer heat disease. Unlike the other climatic pathogenic evils, summer heat is purely exogenous. There is no endogenous summer heat. So here we could see the nature and the pathogenic characteristics of summer heat. So this is actually a young type of evil, which is called summer heat evil. So we have summer heat-induced prostration, which is resulting from hyperthermia. And the young evil often mingles with dampness evil, leading to gastroenteritis. So heat stroke and all these other factors are actually considered young evil, which will lead to summer fever of children. It is an ascending and dispersing characteristic, which will lead to summer fever. And very commonly, this summer heat evil can lead to heat stroke, which actually consumes qi and body fluids. Summer heat is a young evil. Its nature is very hot. Summer heat derives from transformation of severe heat summertime. When attacked by summer heat, patients uniformly show serious yang heat symptoms such as high fever, agitation, flushed face, and a pulse that is surging and large. The nature of summer heat is to ascend and disperse, and it consumes qi and body fluids. When it invades the human body, it tends to enter the qi level of warm illness directly and induce profuse sweating. Profuse sweating will consume body fluids and cause fluid deficiency, which is manifested as oliguria and thirst with a desire to drink. The summer heat evil can also disturb the mind, causing restlessness and agitation. During profuse sweating, qi often escapes with the sweat, resulting in qi deficiency. Thus, patients suffering from summer heat illnesses often exhibit shortness of breath and fatigue, sometimes even sudden loss of consciousness. Summer heat is often mingled with dampness. In addition to being very hot, summer usually comes with much rain and high humidity. Hence, when summer heat induces illness, it is often accompanied by dampness. In clinical practice, in addition to fever and thirst, there are often symptoms of dampness such as fatigue in the limbs, tightness in the chest, nausea and vomiting, and very loose feces. Thank you for your attention.
Let's continue to talk about the emotions, particularly the third part of anger. It is easy to see that the emotion that most threatens the established order is anger, because this emotion may lead people to rebel. Given the Confucian influence on Chinese medicine, I believe it is for this reason that anger plays such a predominant role among the emotional causes of disease. Anger makes qi rebel, that is, to go on the wrong direction, and it is interesting to note that the Chinese character for rebellious qi is ni, which means rebellious, contrary, to counter, to disobey, to defy, to go against. It is easy to see that the social nature of this pathological movement of qi. Indeed, the opposite of ni is shun, which in Chinese medicine denotes qi going the right, proper way again, and it is easy to see the social implication of this term, which means to conform in the same direction as, to obey, to yield to act in submission to. With regard to liver qi stagnation and anger, there are two issues to consider. First, anger is, in my opinion, overdiagnosed as an emotional cause of disease. Second, qi stagnation does not derive always from anger, and it therefore may affect organs other than the liver in emotional problems. Qi stagnation may affect especially the lungs, heart, and spleen. It follows that when we diagnose qi stagnation in a patient, we should not assume that it is necessarily due to liver qi stagnation and to anger. Worry, sadness, grief, and guilt may all cause qi stagnation in the lungs and or the heart. How can we diagnose whether qi stagnation is due to the liver or to another organ? Apart from the difference in symptoms, the pulse is an important diagnostic factor. Generally, in liver qi stagnation, the pulse is wiry in all positions. In qi stagnation due to organs, the pulse is wiry only in that organ's position. Moreover, it may be tight rather than wiry. The lungs are a good case in point. In lung qi stagnation, the lung pulse is often very slightly tight, bearing in mind that the lung pulse should naturally feel relatively soft, and therefore it takes only a very small change to make it tight. In this case history, it is presented here to show how, in my opinion, Western therapists too sometimes overemphasize anger as an emotional cause of disease. A 33-year-old woman complained of a variety of physical symptoms, such as some skin eruptions on the arms, a slight breathlessness, some abdominal distension, and premenstrual tension. On an emotional level, she was depressed, and her immediate problem was a feeling of sadness deriving from the breakup of a relationship. She found it difficult to keep to a long-term relationship and seemed to go from one unsuitable relationship to another, ending up feeling unused by men. This patient had a history of sexual abuse from her stepfather when she was a teenager. She was under therapy, and her therapist suggested that she had repressed anger about the sexual abuse and that she should acknowledge it and manifest it. In my opinion, her pulse and other signs completely contradicted this analysis. Her pulse was weak and soft in general, and the weakest pulse of all was that of the lungs. The heart pulse was very slightly overflowing, her complexion was very pale, and her voice was very weak. On the basis of the pulse, complexion, and voice, I diagnosed primarily lung qi deficiency and qi stagnation of the lungs and heart. Therefore, in my opinion, in her case, the prevailing emotion of deriving from her history of sexual abuse was not anger, but sadness and grief. The counterpart of anger in terms of mental energies is power, dynamism, creativity, and generosity. The same energy that is dissipated in outbursts of anger can be harnessed to achieve one's goal in life. It is probably for this reason that the gallbladder, closely related to the liver, is said to be the source of courage. A strong gallbladder gives one the courage to make decisions and changes in one's life. This aspect of the gallbladder's function is obviously closely linked to the liver and the ethereal soul. If liver blood is deficient, there is fear. If liver blood is abundant, the person will be fearless and decisive. In summary of anger, the term anger should be interpreted broadly to include resentment, repressed anger, feeling aggrieved, frustration, irritation, rage, indignation, animosity, or bitterness. Anger makes qi rise, and many of the symptoms and signs will manifest in the head and neck, such as headaches, tinnitus, dizziness, red blotches on the front part of the neck, a red face, thirst, a bitter taste, and a red tongue with red sides. If the anger is bottled up, it will cause stagnation of liver qi, whereas if it is expressed, it will cause liver yang rising or liver fire blazing. Anger may sometimes disguise itself as depression. Anger may mask guilt. Anger can affect organs other than the liver, for example, stomach and intestines. Anger, like all other emotions, also affect the heart. Anger is probably overemphasized as an emotional cause of disease in Chinese books due to the Confucian influence on Chinese medicine. Qi stagnation does not necessarily derive from anger, and it may affect organs other than the liver. In emotional problems, it especially affects the lungs, heart, and spleen. Thank you for your attention.